Hey, it's Dr. DeMaio here. This is the proximal lower extremity, the hip. We will be doing the knee and ankle in another video. So let's get started. The lower extremities carry your weight. Now, when you move from place to place and they actually assist the body to maintain balance. People don't realize that the hip socket, meaning the femur, fitting into the acetabulum, the acetabulo-femoral joint, has probably the highest concentration of proprioceptors in the lower extremity. Maybe the ankle has similar amount, but what we do is we actually have to feel where we are in space and for balance. And a lot of the muscles attached to the hip are associated with stabilizing your position in space. That would be in a closed chain type action. So the lower extremities, your legs, connect to the rest of the body at the hip joint. And the femur fits into the acetabulum. And the lower extremities can affect your vertebral alignment via the pelvis. As a result, your muscle length across the knee and the hip influence both standing and sitting positions. The hip, knees, and ankles, the hip influences stability, like I said. The knees bring the body closer and farther from the ground and support the body weight at all positions of extremes. And the ankles and feet form a series of bony articulations that support the body's weight and allow movement. Looking at the feet, we have the weight of the body being loaded on both feet, and we have these three arches, the two longitudinal arches, a lateral longitudinal arch and a medial longitudinal arch, and then we have a transverse arch. So those three arches of the foot created by ligaments attached to the bone, and they act like a shock absorber. However, posture can be affected when you asymmetrically lose an arch. And sometimes when you lose one arch, you lose all three in that same foot, maybe not in the same amount. This image to the right is a little bit off because they show you the heels from the back and you see the left foot and you see how that left Achilles tendon bows out. That's demonstrating a pronation of the left foot, but the picture below it is showing a right foot pronated. So I don't know why they did it like that. Maybe the artist screwed up. But anyhow, you would see in a pronated foot a rotation of the knee and the hip. Also, there would be a increased Q angle, which they're not demonstrating there, where the knee gets a valgus type deformity. And then the hip will lower as well on that side. And then the shoulder will try to compensate and lift it up. And then the head will compensate and lift on the opposite side. So the thing is, if you have an asymmetrical loss of your arches, it definitely creates an imbalanced posture. The imbalanced posture is also creating an abnormal muscle tone, or together they're forming an abnormal muscle tone and posture defect. So if you look in the bottom left picture, it shows you what pronation looks like. It's where the actual foot, and they didn't draw it really properly. They should have shown that Achilles tendon bowing out, but you see how the foot would go medially, like it would almost look like the foot is everted. And then the neutral position, you see a line straight up and down. And then the supinated position would actually look like the foot is being inverted. So most commonly people have pronation, and most people walk as a pronator rather than a supinator. And they strike on the outside of their foot and roll the foot medially and push out like a duck. And for every degree that your foot flares out, it slows you down in your stride. Okay, so now muscles that flex the hip, we'll look at muscles that flex the hip, that extend the hip, that abduct the hip, and so on. So right now, let's look at the muscles that flex the hip. Now, if you look on the right, it says 9 hip flexors, but on the left, we numbered them 8. Why? Because the iliopsoas is actually made up of 2 basic muscles. That would be the psoas muscle and the iliacus. So it's called the iliopsoas. And actually my friend who teaches Latin says it's psoas. That's the proper way, iliopsoas or psoas. Crazy stuff. So that is a major hip flexor. And then you also will have the rectus femoris crossing the hip, which is a good hip flexor. The sartorius crosses the hip. This is a good hip flexor. And the pectineus goes from the pubic area and actually can function in hip flexion, a very small, tiny muscle. The tensor fasciae latae can flex the hip. The adductor magnus on the anterior side, and the adductor longus and the adductor brevis all can flex the hip. Okay, so the hip extensors. As you see on the right, it says about 20 degrees. It's not much extension, but it's important because the gluteus maximus is a very strong hip extensor. It's important in the gait cycle. Hamstrings, of course, are important. The three muscles of the hamstring are the biceps femoris laterally, and medially on top is the semitendinosus, and below is the semimembranosus. And the adductor magnus has a effect like in a hamstring because it attaches or originates on the ischial tuberosity as well. And there's some posterior fibers, a lot of posterior fibers there that can assist in the hip extension. So when we look at open chain versus closed chain hip flexion and hip extension, if you look at the image to the left, that image is demonstrating an open chain hip flexion and hip extension. So she's starting in an extended position of the hip and leg, and then she brings her knee up. That's hip flexion. Notice the foot is freely moving distally, so the distal limb is moving, so that's open chain. When you look to the right, you don't see those distal limbs moving. They're staying planted on the ground. It's showing a person getting from a sitting position to a standing position, which is important in the stabilization of the foot, in that the hip muscles, if you notice as he lifts off and his foot goes into maximum dorsiflexion, but then his hip is actually extending, and then full normal hip extension, not hyperextension, at a standing position. So the hip flexors and extensors interact with gravity in the uprights and the sitting position, controlling the trunk through pelvic attachments, of course. The hip flexors counteract the extension effect of gravity, and hip extensors are counteracting the flexion effect of gravity. Balance you front to back in that way. And look in the sitting position, you can see how you have the iliopsoas, which is a hip flexor, can also tilt the pelvis anteriorly. And then the hamstrings, which is a hip extensor, can also tilt the pelvis posteriorly or extend the pelvis. So when you look at pelvis flexion and pelvis extension, some people look at it that way. Some people look at it as a tilt. So in here, and OTs mostly look at it as a pelvic tilt. Notice the images below, how it affects the space and the cord and the disc in those positions as well. Some people have chronic shortening of some muscles associated from too much sitting, and chronic tightening of muscles. Some people have chronic back injuries that cause them to have a posterior tilt. So all these things come into play. Now this is showing you the abductors of the hip. Abduction is bringing away, so you notice she starts from an adducted position in the first image, and the image to the right of her, she's going into abduction of the hip. And it includes, of course, the gluteus medius, the gluteus minimus, the iliopsoas, the tensor fasciae latae, and the sartorius. And then on the inner thigh, the adductors of the hip are found. And you can see it looks like a webbing there almost, right? Just originating from the medial aspect of the pelvis and inserting into the medial side of the femur are the adductor brevis, longus, and magnus, and the gracilis and the tiny little pectineus. Okay, so when we look at the hip abductors and adductors, they also can do open and closed chain activities. And the first image on the right, where the man is bringing his foot across his body like he's kicking a soccer ball to the side of the sidelines, that foot is moving. So it's an open chain movement of adduction. And then the closed chain, notice he shifts his hips, but those muscles are still involved in stabilizing his stance. Okay, external rotation of the hip, otherwise known as lateral rotation. Remember, we learned about the 6 small lateral rotators, or the 6 small deep lateral rotators of the hip. And that's what you see there in the first 6 muscles. Piriformis, gemellus superior, obturator internus, gemellus inferior, obturator externus, quadratus femoris, and then, of course, the gluteus maximus and the iliopsoas also are synergists of external rotation or lateral rotation of the hip. The internal rotators of the hip include the gluteus medius, gluteus minimus, the tensor fascia lata, the pectineus, the adductor longus, and the adductor brevis. The adductor magnus has horizontal fibers also associated with internal rotation of the hip. The image to the right is just showing you a way of looking at internal versus external rotation from a prone position. And then the rotators of the hip also can perform open and closed chains. So that image you saw before, prior to this slide, was open chains because the foot was moving, right? So open chain allow for the femur to serve as a lever arm, generating large amounts of torque, causing either the internal or external rotation, and the foot would be moving. The lower extremity would be moving, the distal part. In a closed chain rotation of the hip, it helps you in balancing the pelvis and trunk over the lower extremity, rotating. A lot of patients I see have rotation of the pelvis in response to an injury to the back, and they try to compensate. And so they literally have a thoracic rotation, a pelvic rotation from on the z-axis. So the rotators of the hip adductors can also internally rotate the hip. Some of them. It depends on the femur's position, and some hip abductors abductors have an effective moment arm for internal rotation as well. Thank you.